And all the way. Good. And you know, I'm going to flatten my technique out a little bit so I'm not so stressful to them. There you go. Right over your head. Back down again. Any pain? No, see, that's beautiful. That's beautiful. Now palm towards Liam, over your head. I wish I could do that.
I wish I could every other day.
Drop it. She must really like you. So he has a left shoulder dysfunction, maybe a little rotator cuff involvement. So we've been adjusting him, and we put you on a shoulder exercise program, correct?
Yep, correct.
And at the end of that, we do some soft tissue work on the shoulder, correct?
Correct.
Yeah. And so overall, what would you say the percentage of improvement has been? 50, 60?
I'd probably say in the 40 to 50 range.
40 to 50 range, yeah. So I think for us, one of the toughest things to take care of, I don't know if I ever shared this with you, are shoulder issues. Did I not say that to you?
Nope.
Yeah, and part of the reason is how much motion takes place in the shoulder, how poor the blood supply is to the shoulder. And you know, no matter what we're doing, even when we're sleeping, it puts a lot of stress on your shoulder if you're not careful how you get yourself in position to sleep. Okay.
Right.
So what I'm going to do is we're trying to work on his upper part of his body mostly. So I've already adjusted his mid back. I'm going to adjust his neck. I'm going to mobilize his shoulder, and then we're going to do some soft tissue. And the last time you were in, Dr. Nick was working on you, right?
Correct.
Did he put you on your side to adjust your low back when you're rolling your hips that way?
No.
Or no, just, okay. Very nice. Is that comfortable?
Yes.
If it wasn't uncomfortable, you'd lie for me, wouldn't you?
No.
Step up for me. Now, let's do this. Let's take the right arm and just bring it in over your head like that for me, all the way to the top. Beautiful. Bring it back down again. Now, turn your palm of your right hand towards me, and then do the same thing. Take that all the way like a windshield wiper, all the way to the top. Okay? Very nice. Now, put that behind your back and reach up towards your middle of your back. Any discomfort with any of that?
No.
No. Let's try to do it with the left arm. First one straight in front of you, okay? How's that feel right now?
It's where it gets a little...
Towards the end?
Yep, towards the end.
So from my perspective, what's happened since we've been working on you is it catches you right there. There's that. The first thing that I'll say is you couldn't get up there before. Now you're almost getting towards the end range of motion.
Yep.
When he comes back down again, because of the anatomy, he has to pass through this painful arc. Once he passes through for it feels a little better, right? So we still have some irritation, inflammation in there a little bit, right?
Yep.
Same thing, all the way over your head.
All right.
Yeah.
This one is not gonna...
Yeah. Okay. Good.
That's about as far as it's going.
About as far. Okay.
Yep.
Now bring it back down.
Slowly.
Yeah. And so the same issue, you get that spot, once you get through it, it's a little bit easier?
Yep.
Okay. Where did you feel that discomfort when you were doing the one at the side?
Mostly here now.
Mostly there, okay.
Yep. That's shifted. It used
was
to be
up in there.
back
Yeah.
here, but it's now much more here.
Yeah, so we have behind the clavicle, we have the supraspinatus, the infraspinatus, then the two teres, and underneath his shoulder blade is the subscapularis. We didn't dry needle your deltoid last time, did we?
No, you haven't dry needled ever since I had the vasovagal.
Yes. So we were, if I could, I would dry needle him, but he doesn't take that very well. So we stopped doing that after the first visit. Come on over here for me. I would love to. We should get the reaction of the staff member that was there trying to take care of you.
Oops.
That's right. Just hit that button. Yeah. All right. So we're gonna put a little moisture on that. Relax that. So we're just using a little bit of Joshua tree ointment to create less friction. I want to be. We were talking about this. I'm careful with how much I put on because I do want a little bit of. I want to have that tactile, or that palpatory resistance, okay? You can relax your arm, I'm sorry.
Sorry.
Let's start up here. So now let's go all the way across. Good. Uncomfortable?
I mean, it's
Yeah.
fine.
Let me know when you start to feel the tension build up.
Right about there.
Right there.
Yep.
Okay. So I'm getting on the attachment of the infraspinatus right here, which again is part of that rotator cuff. Good. Now I want you to do the motion. I want you to take it. Go ahead. I'm going to guide you. And at that last bit, just give me a little extra effort. There you go. Good. Go again. All the way. That way. Very nice. This does feel better, doesn't it?
Mm-hmm.
Yeah, go ahead. That is, it feels better with a little bit of the Joshua tree on it. Yeah, I think it does too. Go ahead. I have to be a convert, a Warren convert. Go ahead. Good. Good. Go ahead again. Beautiful. Now relax. So let's get some up here. Now we're going to come up and get his supraspinatus. So same thing. I'm going to go ahead and put your elbow in the 90-degree position. I'll reach across. So now I just climbed up on top of his supraspinatus. Good. Back over again. Take it across. And all the way. Good. And you know, I'm going to flatten my technique out a little bit so I'm not so stressful to him. There you go. You with me?
Mm-hmm.
Beautiful. Now you do it all without me. And then reach, reach, reach. That away. Good job. Now go ahead again. All the way. Good. Very good. Very good. Now go ahead and stand up for me. Now face Liam, please. Arm straight over your head.
Oh, what a difference.
Yeah. Okay. That's not bad after just a couple passes.
Yeah.
You know, and his homework is this. I'll show you. This is another technique we use to release that stress. So you remember this is where we're going to go. Like we're going to hold. Reach out like this. Reach to your back pocket. All the way down to your knee, right knee. Now up to your mid of your back. Okay. Back up again. So I'm going to help you. I'm going to guide you through it. Okay. So do it again. Internally rotate down to your butt. And we have that hand. He's here, and then we're going to keep that elbow right in there, and we're going to come up like this. Are you doing this at home?
Yes, not exactly the same.
Yeah, this is the way I want it to look, okay?
Okay.
So come on back down. This is why go ahead and reach down. It's important to refresh these things sometimes. We're reaching, and then we're going to come up right here, okay? Good. And again, I'm on top of his supraspinatus for this technique right here. Go ahead back down again. We're treating a rotator cuff type syndrome. Good, very good. Okay. Sometimes I push that a little bit too hard, and I don't, you know, it's a fine line. Okay. Now show me, go ahead and face that way. Show me how you would do that at home without me being with you.
What I was doing?
Yes, what you should be doing, not
Should
what
be
you
doing.
was, not
Okay.
what you were doing. Go ahead. Beautiful. That's perfect right there. That's just home exercise, okay? You know, you've seen us do McKenzie around here with neck and low back. This is a McKenzie for the shoulder, okay? All right, now lie on your back one more time for me, please. And then we're just going to try to mobilize this and see if we can release some of the tension, if there is any tension, in his acromioclavicular joint, which would be right in here. So Liam, hand me that pillow, please, right behind you. Thank you. Lift your head up for me, please. Back down again and slide over towards me. Right there. Now just let me have this. This is not, like you see a manipulation as a high velocity, low amplitude. This is more of a mobilization technique. And I'm looking for his body language. His eyes will tell me a lot. You okay? Mm-hmm. Yeah, relax, let it drop. About a week ago, we got a piece of that AC joint, didn't we, to release? Mm-hmm. See, this is much better mobility in there than you used to have. There it goes right there. Beautiful. So that's a little bit of a mobilization rolled into a manipulation of that AC joint. And unfortunately for you, you don't have just a AC joint dysfunction, because if you did, I'd pop that thing and you'd be like, you would be healed, right? You get your range of motion back almost immediately, right? We have soft tissue we're dealing with here, as well as a little bit dysfunction, not only in that whole complex. It's your neck, it's your shoulder, it's your mid back. Okay. Now let's stand up and let's see how that moves now. Go ahead, I'll take it. All right, let's start with flexion. Yep, straight over your head. Back down again. Any pain? No, see, that's beautiful. That's beautiful. Now palm towards Liam, over your head. I wish I could do that.
I wish I could every other day.
Drop it down. See, how does that? What's different? What has just happened?
Yeah, I mean, other than like one small catch, like
Right,
around
yeah,
here,
yeah,
like
yeah.
it was like it's night and day.
Almost like normal. Yeah, and you can't even see the catch. I know you feel the catch. You can't see the catch anymore. You don't pause. You go right through it. That was great. Yeah. So shoulders are tough, right? Yeah, but we're making really nice progress. And I think it's actually the Joshua tree that's getting us over the hurdle here a little bit. Okay. All righty.
Sounds good.
Good.
All right.
Thank you so much.